Hi, and welcome to Boot Camp Day 7, where we'll be learning about certified workers' compensation healthcare networks. In today's Boot Camp Day 7, we'll be taking it one step at a time to get a good grip on each of the crucial steps we must take when climbing the challenging wall of the certified networks. We do not want to leave you hanging, so don't sweat it. We've got this. Because with our guidance and resources in today's webinar, we are confident you will reach your goal of getting to the top of this challenging wall. The learning objectives for today are to learn what a certified workers' compensation healthcare network is, knowing how to find networks in your area and how to apply to become a network provider, and to understand the importance of intake in identifying the network status of the injury. Before I begin, I need you to know that my presentation today is for your education. However, system participants are responsible for knowing and complying with the statutes and rules. So it is important to become familiar with the Texas Insurance Code, Texas Labor Code, and the Texas Administrative Code. You can find these rules and statutes by using the interactive resources document we sent you along with the login instructions. These are the rules and statutes that will be used to resolve any disputes that you may have. In today's presentation, we will be learning about network preauthorization requirements, how the medical billing and reimbursement works for network claims, and how to resolve disputed issues for claims that are in network and the network report cards. And these report cards will tell you how each network is performing. Let's start with the basics and discuss what is a certified workers' compensation healthcare network. In 2005, the law was changed, and it was House Bill 7 that added Chapter 1305, which establishes and provides regulation of the networks, and added Section 408.031 to the Texas Labor Code, which says that the injured employees can receive care through the network. But if there was ever a conflict with the Texas Labor Code and the Insurance Code, Chapter 1305 would prevail. The networks are where both the Texas Labor Code and the Texas Insurance Code work together for workers' compensation healthcare services. A network is defined in both the Texas Labor Code Section 401.011, subsection 31A, and in the Insurance Code Section 1305.004. Both regulations say that a network is an organization that contracts with the carrier and forms a network of providers to provide services to their injured employees. It's important to know that the Texas Department of Insurance certifies the networks to be able to operate in Texas. And the Managed Care Quality Assurance, or MCQA department, handles the network application and certifications for the networks. Section 406.002 says coverage is generally elective. This means that except for public employers and as otherwise provided by law, an employer may elect to obtain workers' compensation coverage. An employer who elects to obtain the coverage is subject to this subtitle. It is important to know that in Texas, employers are not required to obtain workers' compensation insurance for their employees. Coverage is generally elective. Texas is the only state where employers have a choice to purchase a workers' compensation policy or not. On the left, you'll see the different type of work comp coverage that employers may have. This does not include federal employers. An employer will either be a subscriber or a non-subscriber. A subscriber is an employer that has a workers' comp commercial policy or that has been certified self-insured by TDI and holds a certificate of authority as certified self-insured or group insurer in Texas. Self-insured means these are private employers approved to pay their own workers' compensation losses rather than buy an insurance policy. Private employers can be certified to be self-insured by applying with the Texas Department of Insurance. And then there are employers who are self-insured governmental entities such as public schools, utility, city, or county, um, like first responders that choose to fund its own workers' compensation program or join a pool with other governmental entities. These are also known as 504 political subdivisions. Again, this does not include federal employers like the United States Postal Service or Internal Revenue Service. These claims belong with the Department of Labor. Now, on the right, you see non-subscribers, which means that the employer has opted not to provide workers' compensation insurance coverage for their employees, or sometimes have obtained other types of policies like accident or other similar work comp policies and are not considered true workers' compensation policies. These policies are usually purchased from insurance companies or agents that are not licensed by Texas Department of Insurance. Employer participation in a network. The regulation 1305.004 says that a network is an organization that contracts with the carrier and forms a network of providers to provide services to injured employees. It is important to know that TDI certifies the networks to operate in Texas. The Managed Care Quality Assurance or MCQA department handles the network applications and certifications of the networks themselves, like I had mentioned before. So don't send the applications to MCQA. And currently, about 50% of the Texas claims are of new Texas claims are network claims. This illustration provides you a picture of the different ways healthcare is provided to those employees that work for employers that choose to have coverage. The employers can choose to be part of a network governed by Chapter 1305 or the Texas Insurance Code, or have healthcare services provided in the non-network environment using Texas Labor Code 408 and 413 for those special public or governmental employers that fall into the category called political subdivisions, which are governed by Texas Labor Code 504. And these types of employers have choices within that category. They can have a certified network, they can remain non-network, or they can have a direct contract with the healthcare providers, not through a network. Let's talk about finding a network. Oftentimes, we will receive calls at Comp Connection from healthcare providers that would like to know what networks are operating in their area or how to contact these networks. It is the network that creates and contracts with a panel of healthcare providers. You can obtain contact information available for each network. You can search by the network name or by location, by county. Currently, all Texas counties have some network coverage, and there are currently 26 certified workers' compensation healthcare networks. And I want to show you where to find the list. So I'm going to go switch over to our website. So first, you can log into the tdi.texas.gov or click on, on it on the interactive resources document. You want to click on, once you're on this page, click on workers' compensation at the top right. Then you'll click on the link that's below the picture. It says use workers' compensation A to Z. And here on the topics A to Z, you're going to select the letter N and then go to the third bullet, which says networks, certified workers' compensation healthcare. Under information for injured employees, the green subheading, you'll see the first links. How do I find a certified WC net? Click on that, and it takes you to the different options you have to look. Pull up you can either pull up the list of certified networks, the entire list, or you can do a search by county. So we go to H. You'll see the different counties. Go to Houston. You'll see all the networks in that service area. So I just wanted to show that to you, so you'll know where to find that. This slide and the next three slides go over the steps I just took you to get to the list of the networks. So there, you click on the end. How do I find the network? Click either one. And so you'll have that to reference. Now let's talk about how your healthcare provider can join a network. If your healthcare provider is interested in becoming a healthcare provider in the network, they can complete and submit a Texas standardized credentialing application to the work comp certified network that operate in or cover the employers in your area. The healthcare provider can create or update your healthcare provider's Tex Comp profile, update any addresses, trainings, and certifications. They can also submit any financial disclosures electronically through their Tex Comp profile and update any other information. Now, how can my treating doctor join a network? You'll want to start with the Become a Texas Workers' Compensation Treating Doctor checklist. A treating doctor provides healthcare to the employee for the employee's compensable injury. The treating doctor is responsible for making referrals to other network providers and requesting referrals to out-of-network providers if medically necessary services are not available within the network. This includes referrals to specialists. Treating doctors also participate in the medical case management process as required by the network, including participation in return to work planning. The specialist is also required to coordinate the injured employee's health care with their treating doctor. You'll see on the second page of the checklist where it talks about providing treatment for certified workers' compensation healthcare network injuries. You'll find the hyperlinks to the credentialing requirements and the Texas Standardized Credentialing Application and how to find a certified work comp network on this checklist. This is where you'll find the list of all the 26 certified work comp networks. To join a network or networks, the credentialing process starts with completing and submitting an LHL 234, which is the Texas Standardized Credentialing Application, and to each of the networks they wish to participate with. Please do not send this application to the Texas Department of Insurance Division of Workers' Comp. Note that Texas is not an any willing provider state. This means that a network is not required to contract with a healthcare provider applicant. The network must complete the initial credentialing within 180 days before the healthcare provider is considered a credentialed provider, and they must notify the healthcare provider of their decision no later than 60 days after making their decision. The network is also required to re-credential each network provider every 3 years. You healthcare providers have the right to review information submitted to support the credentialing application, correct erroneous information, and the right to be informed of the status of your credentialing or re-credentialing application. All networks must document and create policies and procedures and develop written criteria for credentialing network providers. Credentialing procedures are part of the network's work plan as outlined in Texas Administrative Code Section 10.81, Quality Improvement Plan, which is reported annually. Now we'll go over network requirements. Notice of the network requirements. The insurance carrier has to notify the employer of the network's requirements. The employer is required to get a signed acknowledgement from each employee, which states that the employee has received the network's information and requirements. The employer also has to post a notice of the network's requirements in their place of employment. And at the time of the employers receive the notice of injury, the injured employee must be notified of the network requirements. Now we'll go over some of the injured employee requirements. The injured employee is entitled to their initial choice of treating doctor and is required to select a treating doctor from the list of contracted providers that they should have received from their employer or the network. If a list of doctors was not provided, the injured employee may contact their employer or the network handling the claim to obtain a list of contracted providers. If the injured employee is not happy with their initial choice of doctor, they may select an alternate treating doctor from the list of contracted providers, and the network may not deny the injured employee's selection of an alternate network doctor. However, any subsequent requests must be authorized by the network. If the injured employee did not receive approval from the network for non emergency health care by an out of network provider, they may be liable for payment. Now, if the injured employee never received the notice of the network requirements from their employer, then the injured employee isn't required to comply with the network requirements, and the insurance carrier is liable for paying the medical care until the employer receives the notice. Now, to turn to contracted treating doctor requirements. This doctor provides health care to the injured employee, makes any necessary referrals to other network providers, or asks for special permission to send the injured employee for medically necessary services that are not available within the network. They must follow the network's preauthorization requirements, adopted treatment, and return to work guidelines, which are identified in the contract, and must participate in the medical case management process as required by the network, including participating in return to work planning. Now we'll talk about network accessibility and availability requirements. The network is required to have a provider panel that includes an adequate number of treating doctors, specialists, and other types of healthcare providers who must be available 24/7 within the network service area, and the network has to arrange for non network or out of network services if a skill or specialty is not available in that network's service area. The provider panel or contracted providers must also include facilities, all types of facilities, and they must make available emergency care that the injured or ill employees might need, and this is without restrictions on where they seek emergency care. Network liability for out of network health care. Does a network have to pay for out of network care? Yes, the insurance carrier that contracts with a network is liable for payment in instances of emergency care, health care for an injured employee who does not live in the service area, and any approved out of network care. When requesting approval for referrals to out of network providers, the network must approve the referrals no later than the 7th day from the referral request. And you want to make sure that you get that approval in writing from the network. If the network denies a referral to an out of network provider, the injured employee may appeal through the network complaint process. Note that getting a pre-authorization approval does not mean you have written approval to treat as an out of network healthcare provider. The pre-authorization approval only establishes medical necessity of the medical services or treatment being requested. Network and intake procedures. This next section will talk about how you can reduce your risk of non-payment because you may have treated an injured employee who is subject to a network when your provider was not contracted with that network. This should be a regular part of your intake screening. Some standard verifications should be first to determine if the injured employee is seeking health care for a work-related injury or illness, or one that they believe is work-related. If they say this during intake, you need to ask more questions. The insured is the employer, so you must find out where they were working when the incident occurred. It is conceivable that the injured employee has changed jobs or no longer works at the place where the incident occurred. Finding out the date of injury and the employer where it happened is key to find out the coverage information. Once you find out the employer, you may start asking and verifying if the employer has chosen to be a subscriber or is a political subdivision like a school district, city, county, or first responders that we talked about earlier. You need to know this to find out if this is a network claim or not. It is also conceivable that one person may have multiple claims or injuries from multiple employers, and some may be network claims and others may not. All the same person, but each injury or illness must be looked at individually. On this note of intake and identifying a work comp network patient, you can watch the video from Bootcamp Day 4, IDing a work comp patient, which is on our healthcare provider page in the on-demand training videos. Once you find out the employer is covered, you want to begin asking if the injury is subject to a network. You may need to ask multiple people like the injured employee, the referring healthcare provider, the injured employee's employer, and or the adjuster or insurance carrier. Again, it is the employer who has made the decision to provide coverage through a network or not. Once you find out once you find out the injury or claim is a network, find out if your provider is contracted, because if not, and it's not an emergency, you're going to need special network permission in writing, or you could be denied when it's time to submit your bills. If the healthcare provider is not contracted with the network or political subdivision employer, they must request written approval to treat as a non-network provider before treating the injured employee, except for emergency care. And remember, like I said, an approval to treat the injured employee as an out-of-network healthcare provider is not the same as a pre-authorization approval for the healthcare to be provided. So remember to get the two written approvals, one to treat as an out-of-network provider and the other for the healthcare you are providing to the injured employee if it requires pre-authorization. This graphic shows you the steps to take for the network intake process, pre-authorization if needed, and if you have network fee disputes. Keep it handy so you can refer to it when needed. Network pre-authorization requirements. This next section will talk about how you can reduce your risk of non-payment because you may have treated an injured employee who is subject to a network when your provider was not contracted with that network. This should be a regular part of your screening. The Labor Code's pre-authorization requirements do not apply to healthcare provided through a network, except for pharmacy formulary requirements. This means that both non-network and network claims are subject to the pharmacy pre-authorization requirements found in Rule 134.600. In this illustration, you'll see that all FDA-approved drugs are included in the closed formulary and do not require pre-authorization. Drugs that are excluded, like drugs with status N that are found in the Appendix A from the Official Disability Guidelines, or ODG, or on our website. Investigational or experimental drugs and all prescribed drugs created through compounding will also require pre-authorization. Each contract with the healthcare provider outlines the network's pre-authorization requirement and process. Remember, pre-authorization is not required for emergency treatment and services. If the carrier's utilization review agent has pre-authorized treatment, payment may not be denied for medical necessity, similar to non-network processes. However, pre-auth does not automatically guarantee you'll be paid. Some reasons not related to medical necessity that your bill may be denied for are compensability, extent of injury, relatedness, or liability, or if you didn't follow coding, billing, or documentation requirements. Could be denied for timely filing or not getting out-of-network approval. This is why it is very important to review your network contract requirements or to contact the network when you have questions. Now we'll get into the network medical billing and reimbursement. When you are treating a network claim and how much you will be paid for what circumstance. There will be regulation that comes from both parts of the statute and administrative code, which are the Insurance Code 1305.153, Provider Reimbursement, and Texas Administrative Code Chapter 133, General Medical Provisions. Chapter 133 in the Texas Administrative Code has all the rules for medical billing, and in Rule 133.1, applicability of medical billing and processing. It talks about the exceptions that do not apply to the network claims, including medical documentation, which networks may decrease the documentation requirements, and some of the provisions of medical payments and denials and fee disputes, which are handled differently and which we'll cover later on in this presentation. In general, healthcare providers and carriers must follow the same timeframes in Chapter 133 for billing within 95 days from the date of service, and insurance carriers must pay, reduce, or deny within 45 days of receiving a complete medical bill. Medical bill reimbursement. Another reason to make the contract available to the right staff members is that the reimbursement is negotiated between the healthcare provider and the network, and it should be outlined in the network contract. So if you want to know what you will be paid, you need to review your contract. Each network can have their own fee schedules that are different than non-network. There are some exceptions like emergency care, health care for an injured employee who lives outside of the service area, and healthcare provided by an out-of-network healthcare provider with approval. Healthcare services provided to an injured employee who does not live within the network service area are reimbursed by non-network fee guidelines. Some other exceptions are designated doctor or required medical exams, referred doctor MMI and impairment rating exams, and treating doctor exams. The insurance carriers cannot apply discounts to these types of exams effective June 1st, 2024, or treating doctor exams to define compensable injury. The non-network rules would apply in these circumstances. In helping you find out if a network was involved in the billing process, Chapter 133, specifically Rule 133.240, subsection F, requires that the name of the network to be on the EOB. And if there is an informal or voluntary network, the name of that should also be on the EOB. Reimbursement for pharmacy services. Pharmacy was basically carved out of the network statutes and rules, and pharmacy services may not be provided through a network. That means the pharmacy reimbursement will follow one of these three ways. One, according to the network guidelines, which is Texas Administrative Code Rule Section 134.503. And here are the other two ways pharmacies may be reimbursed due to a provision in the statute that allows an insurance carrier to negotiate contracts with a specific pharmacy, and that contract includes a specific fee guideline, or there is an informal or voluntary network that negotiates with the pharmacy. Regardless, an injured employee has their choice of which pharmacy they choose to get their medication from. And you can go to our topics A to Z and select the letter I for informal networks, and you can read more about those types of networks. For durable medical equipment, or DME, and home health services that are provided by a certified network, reimbursement shall be made according to the contract. Or if it's provided out of network and that is approved, then the network fee guideline will apply. However, a carrier may pay fees that are inconsistent with non-network fee guidelines if there is a direct contract between the carrier and healthcare provider through an informal network. Now let's go over dispute resolution for network claims. Here's a chart to outline each of the general reasons why a medical bill might not be paid. We group them in these categories on the left, and the administrative remedies or dispute process on the right. Number one, we have compensability, extent of injury, relatedness, or liability as the dispute type. And on the right, we have the dispute process you may pursue to resolve the disputed issues, which in this case is the DWC benefit dispute resolution hearing process. Number two, medical necessity disputes. The appropriate dispute process is through the independent review organization process, and that's when you would submit the LHL 009 form. And last, when there are medical fee disputes, you may pursue the network's complaint process. Remember, medical fee dispute resolution with the Division of Workers' Comp is not the appropriate process to pursue because DWC does not have jurisdiction to make decisions about network claims. So, again, if the injured employee claim is in network and you have a medical fee dispute, you will file the complaint with the network that issued the EOB denials. First, let's talk about when the insurance carrier denies your bills for compensability, extent of injury, relatedness, or liability, which we call SERL. There is a special provision in the network regulation that gives network providers information about the carrier disputing the compensability of an injury in writing. This provision is not found on the non-network side, meaning the carrier is not required to send a copy of the notice of dispute to the healthcare provider, but on the network side, they are required. And all medically necessary services provided prior to the notice must be paid up to $7,000 in reimbursement and not charges. Even if the carrier wins during the dispute, the carrier is still liable up to $7,000 for health care that was provided prior to the filing of the PLN 1 disputing compensability. Just like non-network claims, if the carrier disputes compensability or extent of injury, relatedness, or liability, the dispute remedies follow the same path. These paths include benefit review conference, contested case hearing, appeals panel, and on to district court if not resolved through these DWC administrative remedies. Now we'll talk about network medical necessity disputes. This is a graphical illustration of a decision tree for pre-authorization staff when making a decision to request pre-authorization in the network's compensation system and the steps to take to dispute a denial by the network if you receive one. You might want to use this as a cheat sheet or a training tool. And this is an illustration of the IRO process you will need to pursue when pre-authorization requests are denied by the insurance carrier and when bills are denied as not medically necessary. This shows what happens after you file your LHL 009 form. And now we'll talk about the network fee disputes and complaint process. If you have a network fee dispute for a network claim, this dispute will be resolved through the network complaint process. Remember, as I mentioned earlier, DWC's MFDR process is not the appropriate process to dispute a network denial. If you file the dispute with the DWC's MFDR, it will be dismissed, except when an out-of-network healthcare provider that was approved by the network to provide the healthcare to the injured employees subject to a network. These types of network fee disputes are resolved through the DWC's MFDR process. Now for the network complaint process. Each network is required to have a complaint resolution system in place, so don't let them tell you otherwise. I've received calls in ComConnection where the healthcare provider calls the insurance carrier and they're notified of the EOB denials and are told they must file a MFDR with DWC. This is not the correct process to pursue for network claim denials. I tell them to call back and reference insurance code chapter 1305, subchapter I, section 1305.401, and to file their complaint with the network. If you're not sure which dispute process to pursue, because I know it can be confusing at times, please call us at ComConnection and we can point you down the correct dispute path. You don't want to waste your time nor our time by pursuing the incorrect process to resolve your disputed issues. Because I also receive many calls from healthcare providers that have filed a DWC MFDR form and have received a dismissal because they filed their dispute with the inappropriate venue, and they've now missed their deadlines to file the complaint with the network's complaint process, because the network requires a complaint to be filed not later than the 90th day after the date of the event or occurrence that is the basis for the complaint. So you don't want to waste your time pursuing the wrong process. Insurance Code Section 1305.402 says that the network is required to acknowledge receipt of your complaint no later than the 7th calendar day after receiving your complaint, with a description of the network's complaint procedures and deadlines. And they are also required to investigate and resolve the complaint no later than the 30th calendar day after the date the network received the complaint, and must maintain a record of the complaint and related proceeding. Insurance Code Section 1305.404 prohibits the network from retaliatory action against an employer or employee because they have filed a complaint. Also, the network requires a contracted healthcare provider to post a notice in their office to the injured employees about the process for resolving complaints with the network. Any unresolved complaints filed with the network or a dispute through the insurance carrier on whether the injured employee lives within the network service where you are dissatisfied or disagree with the decision made on your complaint, you may file a complaint with the Consumer Protection Department through the TDI portal. Network report cards. In accordance with the research duties assigned to the group under Chapter 405 Labor Code, the TDI Workers' Compensation Research and Evaluation Group will objectively evaluate the impact of the workers' compensation healthcare networks certified under this chapter on the cost and quality of medical care provided to injured employees, and report the group's findings to the governor, the lieutenant governor, the Speaker of the House of Representatives, and the members of the legislature not later than December 1st of each even numbered year, and they publish an annual information report card. Okay, so let's review what we've learned today. We learned about the network's pre-authorization requirements, medical billing and reimbursement, dispute resolution, and report cards. Now we want to flex your knowledge with a fun and challenging exercise. We put together 5 questions that are based on today's webinar to test how well you've absorbed the material that we went over today. Question number 1, when a healthcare provider wants to join a workers' compensation certified network, where do they send the completed application? And the correct answer is B, or the second choice. You're going to send it to the individual certified workers' compensation healthcare network that you want to participate with. So be sure not to send it to MCQA nor to the Division of Workers' Comp. Send it directly to the network. Number 2, and number 2, does a healthcare provider's intake team need to determine if the injury is a network claim or not? The answer is true, and most of you got that right. Yes, remember, it's very important to know, because you risk not getting paid if the injured employee's claim is in network and you're not participating in that network. Because in these instances, you must obtain an approval from the network in writing to treat that injured employee, or you're going to risk non-payment for your services. Number 3, each contract with a healthcare provider outlines the network's pre-authorization requirements. Again, this is true. And you'll want to make sure your contract is available to the right staff members because you may need to review your contract if you have questions about the network's pre-authorizations or payment. And majority got that correct. Great job. Number 4, generally reimbursement for healthcare provided to a network claim is determined by the network contract. Also true. So please don't call Comp Connection to ask for a work comp fee schedule because we don't have access to your healthcare provider's contract with that network. You'll have to review your contract for this information. And majority got that right. Number 5, network fee disputes are resolved through the network complaint process, not through the DWC medical fee dispute resolution process or MFDR. That is true also. Medical fee dispute does not have jurisdiction to make decisions about network claims unless the healthcare provider receive approval to treat as an out-of-network provider. Then in those cases, it would be the medical fee dispute department to make a decision on those. So otherwise, you must file your complaint with the network. Well, thank you all who participated. I think we did a great job. And you have your notes or your slides so you can refer back to, if you forget, Please contact us at Comp Connection if you have any questions after we leave this presentation. And you can either contact us by calling 800-252-7031, option 3, or sending an email to compconnection@tdi.texas.gov. This concludes today's presentation. Thank you for watching.